George, thanks for joining me today.
Thanks for having me.
George, let's talk a bit about Liberty Health Sciences. What's the business model?
Well, it's exciting times. You know, we definitely identified an opportunity in the U.S. to really be pioneers. Of course, with being pioneers, we determined the opportunities with, first of all, a mass population, secondly, a quickly changing landscape, with over 29 states currently approving medical cannabis, and that continuously moving forward. And we wanted to be the first and the largest in the U.S. space, so we decided to proceed with Liberty Health Sciences in acquiring, owning, and operating licenses in medical states.
Okay, so the big question everybody has when they hear about a Canadian company in the United States, there was a bit of a dust-up with the exchange recently where there was an indication that there may or may not be some clearing services for Canadian-listed companies with U.S. marijuana assets. What is exactly the status of that situation?
Well, we're happy to say that TMX has already discussed their position, and there's no bans from the CDS and any clearance with anyone that is currently on the CSE. So its progress is forward. We continue to raise capital in the space, as you saw several weeks ago.
Sure.
And we're going to go and quickly continue on our path to be successful in the U.S.
So tell me about some of the projects that you're involved with.
Yeah, well, Florida was our first touch-off point, and Florida was important for us because Florida really demonstrates to the other areas that we want to expand into that we can be successful in the U.S. Florida, first and foremost, has a medical system, and that's really important for us, first and foremost, because what does that enable us to do? Through our licensing agreement with AFRIA, we can launch medically faced products within the entire marketplace. But Florida, as you've seen, it's grown to 56,000 patients, one of the fastest growing industries or markets within the U.S. But also what was important for us was that it allowed for a license that had unlimited canopy size. And that's important for us because why? We can leverage that of what AFRIA has really done, and that's the IP and the know-how that we are gaining through our partnership with them.
Sure. What's the percentage ownership that AFRIA has of Liberty Health Sciences?
37%.
37%. So this is, in effect, an AFRIA subsidiary, not entirely owned, though.
Not entirely owned.
But your product development and your go-to-market strategy in the U.S. is in partnership with AFRIA?
I would say primarily from the cultivation side. Obviously in Florida, you have a completely vertical market with aspects of the business that are quite different than that of Canada. So we have processing and dispensaries as part of our license. So we have the ability to open up to 25 dispensaries. We own the complete vertical, which also allows us to obviously maximize our margins, but we own the patient journey, and that's the most important part of what we're doing, especially in a market in its infancy.
Right, no doubt. So what is the business model? Well,
the business model, first and foremost, is to go into states that are medical, and that is highly important for us. So you'll see us really stay away from certain other states that many people find attractive. California.
So as an operator or as an investor?
As an operator.
Oh, okay, so that's it.
As an operator, absolutely. So that's first and foremost. The second piece of it is that we would like to go into markets that are highly restrictive. So Florida is a great example of it. Started initially with 7 licenses, now 12 in a population of 20.6 million people. When you put that in comparison to what Canada has to offer from a population standpoint, a lot more attractive for our investor base, especially if we take a dominant position in the space.
Wow. Wow, and so do the numbers sort of reflect the numbers in Canada in terms of percentage of population that will gravitate towards medical marijuana now that it's a legal product?
Well, that's part of our discipline in how we analyze markets. So we take a look at markets and we say, what are the chronic conditions that are approved within that marketplace? As we saw in New York, many people flocked to that market, but it didn't really pan out to be that great because it's very narrow on what chronic conditions were approved for a medical document. Where in Florida, over 30% currently qualify for a medical document. That's 6 million people in the space. 56,000 people currently have a medical document and can get medical cannabis. It's growing at a 20% rate month over month.
Wow. Okay, the other big regulatory question mark, I guess, is for the federal illegality of marijuana in the United States. How is that going to affect your ability to repatriate income and capital to Canadian investors? Is there an issue there?
No, there's no issue. You know, there's been commentary made in the past. These are closed loop systems. We have proper financial backing in all of the states that we're working in. We have complete transparency and setups with any bank or institution that we work in any state. So it's not an issue. Currently, under the Rohrabacher Act, there cannot be any federal dollars used to prosecute individuals within any states that have medical cannabis.
Right.
And that's continuing to move forward.
Oh, great.
Jeff Sessions has clearly indicated that in his last statement, and we feel after the Leahy Amendment, it'll be approved for another year.
Those guys are on their way out anyways, come on. But, okay, so anyways, then when do you start to recognize some revenue?
Yeah, so we've already started selling. We have currently a very small base of patients, but where we'll see a large influx of patients is in 2 weeks. We open up our first dispensary, and I don't want to use the term dispensary because we are taking a very different approach. We're calling them cannabis education centers. And why that's important is, again, the market's in its infancy, and we need to ensure that we're educating patients first and foremost because we need to make them feel safe with the use of it. Again, cannabis is an alternative to traditional medicines in many people's minds, and we need to educate how they use it, titration, onset. When they leave that store, they need to be comfortable. And that's why we'll have the highest retention out of any of our competitors in the market.
Okay, so is Liberty's strategy strictly medical, or is there any contemplation of adopting or making ready for the opportunity in the recreational space in the U.S. as well?
Right. For the time being, it's completely medical. But what's important with that, James, it allows us to really secure and establish the right operational plan. Operations is the key to anything, and we've seen it in Canada. Those that can really operate are going to be the leaders in this space.
Right.
And with us, we want to establish a multi-state footprint with great operations. And if recreational does come to us in some of these states, then we are prepared.
Right.
We are prepared with brands. We are prepared through licensing. We are prepared to act in a recreational landscape. But right now, we're strictly medical.
Cool. All right, George, we're going to leave it there for now. We'll come back to you in a quarter's time and see how you're doing. Thanks for coming in today.
Thank you very much.